Stop scrolling, because today's AI news has a very different center of gravity. OpenAI did not just ship another generic model update. It pushed health, medicine, enterprise controls, policy strategy, hardware positioning, and talent into the same news cycle. That makes June 18 feel like a preview of where the next AI race is going. Not just smarter chat. More trusted health answers. More scientific workflows. More enterprise governance. More Washington expertise. More hardware ambition. And, running beside all of that, Anthropic is still trying to resolve the Fable and Mythos export control mess. So this is today's UGTP AI Intelligence Desk. We are going receipt by receipt. The big thesis is simple: AI companies are no longer trying to win only by saying the model is smarter. They are trying to prove the model can work in high-stakes domains, inside organizations, under policy pressure, and eventually inside devices people carry around every day. Hit subscribe if you want the daily AI story with the hype removed and the signal turned up.
Powered by artificial intelligence.
The lead story is OpenAI's health intelligence update for ChatGPT. OpenAI says more than 230 million people turn to ChatGPT each week for health and wellness questions. That is a staggering number, and it explains why health is becoming one of the highest-stakes consumer AI surfaces. People are asking about symptoms, lab results, appointments, insurance, habits, and what to ask a doctor next. That does not make ChatGPT a doctor, but it does make the quality of its answers socially important. OpenAI says GPT 5.5 Instant brings frontier health intelligence to more people, including free ChatGPT users subject to limits. The company highlights improvements in recognizing when urgent care may be needed, asking for relevant context, explaining uncertainty, and making complex information easier to understand. It also says privacy-preserving production monitors show the rate of health responses with at least one flagged factuality issue fell 71% in the last 2 months. That is the kind of claim that needs continued scrutiny, but it also shows the direction. Health AI is becoming measured, monitored, and productized at consumer scale. The most important part of the health update may not be the model name. It may be the evaluation layer. OpenAI points to HealthBench and HealthBench Professional, using realistic health conversations and physician-written rubrics. Those rubrics look at accuracy, safety, communication, context awareness, completeness, and appropriate escalation. That is exactly the kind of structure you need when the domain is messy and human stakes are real. OpenAI also says physicians help define what good behavior looks like by reviewing responses, describing ideal behavior, and identifying failure modes. That phrase, failure modes, is the tell. Health AI cannot be judged only by whether an answer sounds confident. It has to know when to ask more, when to say uncertainty clearly, when to recommend professional care, and when not to overreach. This is why benchmark design is becoming part of the AI race. If you cannot measure domain-specific behavior, you cannot responsibly improve it. The rare disease story is where the health narrative becomes more concrete. OpenAI highlighted work using AI to help physicians diagnose rare genetic diseases affecting children. This is the kind of use case that makes much more sense than a chatbot pretending to be a replacement doctor. Rare disease diagnosis often involves scattered records, complex symptoms, genetic information, medical history, and a long diagnostic journey. AI can help organize clues and surface possibilities, but the clinical judgment still belongs with physicians. That distinction matters. The strongest medical AI stories are not the ones that promise instant replacement. They are the ones that reduce cognitive overload, organize evidence, help specialists ask better questions, and make rare patterns easier to spot. If AI helps a clinician get to a useful hypothesis faster, that is meaningful. But it has to sit inside a process with accountability, review, privacy, and patient safety. That is the difference between health AI as a gimmick and health AI as infrastructure. The second health-adjacent thread is life sciences. OpenAI's near-autonomous AI chemist research points toward AI systems that can help improve challenging reactions in medicinal chemistry. Pair that with LifeSci, and the pattern is clear. OpenAI is trying to show that frontier models can participate in scientific work loops, not just answer questions. This matters because scientific AI has a different standard from consumer chat. A useful research assistant has to reason through protocols, compare evidence, avoid hallucinating procedures, understand constraints, and sometimes connect to lab automation or experimental records. That means evaluation is again central. LifeSci is part of the broader push to measure whether models can handle real life sciences tasks rather than cherry-picked examples. If this direction works, AI's value is not just writing summaries. It is helping teams search scientific possibility space faster and with better evidence trails. Now shift from medicine to the business layer. OpenAI also announced new usage analytics and updated spend controls for enterprises. That may sound less exciting than health intelligence, but it is one of the most important signals for real adoption. Companies do not only ask, can employees use AI? They ask, who is using it, for what, at what cost, with which limits, and with what business value. The first wave of enterprise AI was access. Give people seats. Let them experiment. The next wave is governance and economics. Finance teams want predictable spending. Security teams want visibility. Business leaders want usage tied to outcomes. Platform teams want controls that prevent surprise bills and messy rollout patterns. Spend controls are not a side feature. They are how AI becomes boring enough to be trusted in a company. And in enterprise software, boring enough to trust is often where the serious money begins. Axios reports that AI scholar Dean Ball is joining OpenAI to lead a new strategic futures unit focused on frontier AI policy and governance strategy. Treat this as reported news, but the signal is hard to miss. OpenAI is building more policy muscle at exactly the moment governments are deciding how to regulate frontier systems, user safety, national security, and AI competition. This is not just reputation management. Policy expertise changes product strategy. It shapes how a company talks to Washington, how it anticipates regulation, how it designs internal governance, and how it responds when rivals or lawmakers push for new rules. Frontier AI companies are becoming political actors whether they like that label or not. The labs that understand policy early may move faster because they know where the walls are. The labs that ignore policy may discover the walls only when they hit them. 2 Axios reports add the talent war layer. First, Ha Tai is reportedly leaving Meta to lead communications for OpenAI's devices division. That matters because OpenAI's hardware effort with Johnny Ive's love from is one of the biggest open questions in consumer AI. If AI moves from apps into dedicated devices, the communication challenge is huge. Explain the product, earn trust, avoid creepy positioning, and make the value obvious to normal people. Second, Axios reports that Noam Shazir is leaving Google for OpenAI. Shazir is one of the most watched AI researchers in the field, and the move underlines how intense the talent market has become. The biggest labs are not only competing over chips and benchmarks. They are competing over researchers, product leaders, policy experts, and the people who can turn AI into consumer products. That is why today's OpenAI story feels so broad. The company is trying to build the model layer, the health layer, the enterprise layer, the policy layer, and the device layer at the same time. Anthropic is still the policy cliffhanger. The New York Post reports that Anthropic floated a proposal to Commerce Secretary Howard Lutnick aimed at ending the U.S. ban on access to Mythos and Fable. The report says the company pledged better communication and cooperation with the White House around national security concerns. Again, this is reported news, not a public agreement document, but it is the freshest turn in the story. The Verge also framed the situation as an export control puzzle that the industry does not fully understand. That is the core issue. Are cloud-hosted model capabilities export-controlled like sensitive technology? If so, how do companies enforce that across customers, employees, contractors, APIs, and international partners? The Anthropic dispute may eventually become a narrow episode. Or it may become the template for how governments control frontier model access. Either way, every major lab is watching because the answer will shape launch plans, customer contracts, internal access, and global deployment. Before we leave the health story, there is a safety line that deserves its own segment. A better health chatbot can be genuinely useful, but it can also become dangerous if users treat fluent language as medical authority. OpenAI's own framing points to the right tension. The company talks about recognizing when urgent care may be needed, asking for relevant context, explaining uncertainty, and making complex information easier to understand. Those are not decorative features. They are the difference between a helpful assistant and a confident mistake machine. The hard product question is how to help people without impersonating a clinician. A user may come in anxious, underinformed, embarrassed, uninsured, or unable to get quick care. The model has to be useful inside that reality, but it also has to avoid false reassurance, overdiagnosis, and one-size-fits-all advice. That is why physician-led evaluation matters. It gives the product team a way to grade not only correctness, but judgment. Did the model ask the missing question? Did it flag a red sign? Did it say what it does not know? Did it nudge the user toward professional care when the stakes were high? Health AI will be judged on those moments. The enterprise spend controls story also deserves more weight because it explains where the business market is going. In 2023 and 2024, a lot of AI buying was experimental. Give a team access, run pilots, see what happens. In 2026, the question is different. How do you manage AI across thousands of employees, dozens of departments, and a growing list of agents, connectors, copilots, automations, and workflows? That is why usage analytics and spend controls are not boring admin features. They are the surface where executives decide whether AI is a controllable operating expense or a runaway experiment. A company needs to know which teams are using AI, which workflows are consuming the most, whether spending maps to value, and where limits should be placed. It also needs policy visibility, what data can be used, what tools can be connected, and what approvals are required for sensitive tasks. The labs that build the best controls may win enterprise trust even when competitors have strong models. Because inside a real organization, the question is not only, can the model answer? It is, can the organization safely manage the model at scale? The reported OpenAI devices hire is easy to dismiss as staffing news, but it points at one of the biggest unresolved AI questions. What is the interface after the chat window? The phone already exists. Smart speakers already exist. Wearables already exist. So an OpenAI device cannot win by simply being another rectangle, another speaker, or another notification surface. It has to make AI feel natural in a way current interfaces do not. That means the communications job is actually strategic. People will ask, is it always listening? What does it remember? Where does my data go? What can it do without permission? What happens when it is wrong? Why do I need this instead of an app? The product has to answer those questions through design, not just marketing copy. And if Noam Shazir's reported move to OpenAI is part of a broader talent surge, the company is clearly trying to stack research, product, and interface bets at the same time. The future consumer AI winner may not be the lab with the biggest model alone. It may be the lab that creates the most useful default place for that model to live. Here is the watch list. First, health. OpenAI's numbers are big, and the potential is real, but the key question is whether model health improvements become independently trusted clinical workflows, not just impressive product claims. Second, devices. If OpenAI's hardware team is moving toward a real consumer product, watch how it explains trust, privacy, memory, context, and everyday usefulness. The first successful AI device probably will not feel like a phone replacement. It will feel like a new interface category. Third, Anthropic. If the Fable and Mythos negotiation produces a formal path for frontier model access, that may become a model for the whole industry. If it stays vague, every lab will have to price in regulatory surprise. Today's AI story is health, policy, enterprise controls, talent, hardware, and export rules all moving at once. Comment with the thread you want tomorrow's desk to chase, and subscribe for daily AI coverage with receipts. That is today's UGTP AI Intelligence Desk.